If I can save one life, if I can help many people have the same opportunity as I had, why should somebody like myself have this opportunity that's not given to others? And that's driven me every day, every single day.
Okay, everyone. What do people think of the film, the movie? Thumbs up? A huge thanks to David for making all this possible, and a lot more besides, because he set up IHDA.ie, a heart disease awareness charity, which is doing a lot of other peripheral work, and helping me as well with a book that will be published later, and many other things. But I'd just like to ask the question of David, because they very briefly touched on his story in the movie, not in great depth. So I just asked David, you've gone through an extraordinary journey of discovery after receiving that shocking result shown in the movie. So maybe in your own words, how it happened and all the bizarre things you discovered over your journey.
Okay, thanks very much for that, and thank you for taking your time out today to watch it. And I just want to make it very clear at the start that while I'm a businessman, this is a philanthropy effort in everything I've done. I've no interest in any business aspect or anything like that. I just feel that it was a story worth telling. I will go through parts of that at the moment, but I suppose for the simplicity of it is that 30 years ago there was TB. We did an X-ray and we treated the people. And we had that same opportunity for heart disease 30 years ago. 4 million Americans have died, 40,000 people died in Ireland, and every day 10 people drop dead, most of whom do not have any idea of a disease. So I think it's one of the most shocking stories of the last 30 years. And I really do think, for me, looking at those people who 30 years ago were there to find a discovery that when they saw plaque, they could identify disease. We know it's progressive and it could be treatable. And for 30 years, the system said no. It now says yes, but even today, 99% of doctors don't know. It's recommended for middle-risk patients. So really, it's not a test that one does until men are 45, women are 55. Many of your parents may be at that stage. But it's an extraordinarily powerful, and people can do something, as I was fortunate enough to do. But I really do think, in my mind, it's one of the greatest tragedies in the last number of years. So how it happened for me was that I've done 15 annual medicals in Ireland, passed them with flying colours, one of the 10% fittest people there is. My colleague who ran the American business, at 65, I insisted he did a full medical. And when he did the full medical in the States, they found out that he had a very severe form of skin cancer. So he said to me, listen, Dave, I've done this, it saved my life, this test, you better go and do this full scan, full test in the Cooper Clinic in the States, in Dallas. So I went and did it. I got a score of 906, calcification, that was all. Told to go take a statin. Came home, went on holidays. I'm asymptomatic now. Let's be clear, I was very very fit. And came home, and I just said on the internet, I'll look at this. What is calcification? Never heard of it before. Most people have never heard about it. And very clearly, my score was as significant as it was, and I saw this as really, really serious. This is really serious. So we talked about Framingham earlier. I saw very clearly that while I was 3% risk per this convoluted percentage basis, when you actually measured my level of disease, I was arteries of an 85-year-old, and 75% of people have a heart attack in the next 10 years. So under Framingham, I have a 3% risk, and under the actual mechanism of identifying disease of a 75% risk. And I passed 5 of the 6 factors that Ivor talked about earlier. So very clearly, so then I brought myself in, went into the Hermitage, and they did an angiogram on me, 99% blocked artery, 70% blocked artery. They wanted to do surgery, bypass or a stent. And I pick up the phone to the States and I said, listen, I've just done a test with you. You told me I was absolutely okay. So they said, well, there's no need for surgery. So here I am, Framingham telling me 3v75, somebody telling me I need to have surgery, and someone telling me I didn't need surgery. And therefore, I said to myself, I need to understand all of this, because Ivor's an engineer. I run a business. I deal with information every day. I deal with information. That's my expertise and my skill. Take information, make decisions based on information. So I looked at the studies, and the studies were frightening. I mean, these studies that you saw going back there were over 30 years. If you had calcification, you're 8 times more likely to have an event, heart attack or stroke. If you didn't have any calcification, 99% of people were alive in the 10 years' time. And 75% of events happened in those people who were in the top 25 percentile of scores. And there was studies after studies, 44,000, 25,000, 30,000, 15,000, 75,000, all gave the same results. And I'm looking and saying, why does anybody not know this? Why is this of information not known? So obviously I'm trying to look after myself. I think I'm a dead man walking, because I've done the things you're supposed to do. So I went across to the state. I took 6 months off work. I was very fortunate to own my own business. And I went across to the States and met some of those preventive cardiologists you saw in the movie there. I did a documentary for RTE called Heart of the Matter with George Lee. I've set up the Irish Heart Disease Awareness. And I was in a position to do the movie here, fund the movie. I didn't have any editorial input. I just let somebody else do it. And I suppose for me, the fascination to think that we got it so wrong, that 30 years ago, we had a choice and we made the wrong choice. And the wrong choice has caused so many millions of people to die. And don't get me wrong, stents are really important if you're having a heart attack. If you're having a heart attack, they open up the artery. But the cause of your disease is there. It continues the day after you have a stent. So it's really important. So don't get me wrong, these cardiologists and Ross, who we saw earlier today, they're dealing with patients. They're only looking at the patient in front of them. They're saving their lives. They're doing what they're doing in their training, and they are really hardworking and very much focused on looking after that patient. So I suppose for me, the movie, it's a legacy. It's not for me, it's about the story of these great men who nobody in history has ever heard. Imagine finding a mechanism to identify heart disease and the system said no. I mean, you can get heroes in your lives, but these are the greatest heroes to me. And nobody knows about them. So, and I suppose the movie has been it's on Netflix US at the moment, it's on iTunes, it got 7 out of 7 Rotten Tomatoes. Roger Ebert gave it the highest ranked movie. But really it hasn't moved things the way I would have loved it to move, because I really wanted to make a difference. And it's not about me, it's about the people who don't get that opportunity. And there's too many of them. So having done all the mechanism, having done all the studies on things or whatever, the key message is heart disease isn't an event. It's a progressive disease, it's measurable, and it's manageable. And the sooner, like any progressive disease, you find out you can do something about it. So why wait till someone has a heart attack or dead? I don't agree with that. So within that journey, I suppose I went to the States and I found this group called Track Your Plaque with Dr. Davis. And I kind of went on this kind of no wheat diet. But I was doing things, but I really didn't understand why I'm a dyslexic. So I like to have to keep things simple. And I couldn't understand why I had this level of disease. So I went on my statin medication because it reduces inflammation. And I knew what I wanted to do was control the growth. And what's really important in this is the soft plaque becomes calcified. And calcified plaque is safe, but the more calcified plaque you have, the more disease process. So it's a bit like cancer. And the more you have, the more it's going to grow. And while it might be malignant today, it may become terminal tomorrow. So the more times you have that disease process, the more likely you're going to have a rupture and you're going to die. And 70% of heart attacks are plaque rupture, i.e. a piece of plaque breaks off, causes a blockage, and you're dead. Strokes are caused that way. Plaque is the disease process. So very clearly, I was trying to make sure that this was the program I was part of. And as you see, it's the mammogram of the heart. And what really I could never understand, and I still to this day don't understand, how can you put people into 3 categories, low, middle, and high risk? And most people who have a heart attack are middle risk. I mean, what is risk supposed to be? And you have a mechanism to identify real disease. So I still don't get that. I still don't get that. But, as I said, the stent is really important. The stent really deals with people with symptoms. But as you saw from the COURAGE study, they gave comparisons with people with chest pains and a blocked artery. They gave them stent and optical medical therapy, and they gave them optical medical therapy. And at the end of the day, optical medical therapy worked out as well. So what we see is that it's a disease, and people, when they have a heart attack, are put on a disease management program. So we know putting a stent in doesn't extend your life. We know there's a disease management program that can do. So why don't we identify those people with the disease and put them on the disease management program before they're dead? And, if we look at mammograms in women and we look at that whole area, we don't go to women and we say to women, you have a disease, the earlier you have you identify the disease, the earlier you treat it, the better the outcomes. So that's really the whole focus. And most heart attacks happen from plaque rupture and narrowing arteries, don't happen in the main arteries. So, if I look at today in areas that get the highlights, 5 times more women have heart attacks than breast cancer. 5,000 people die of this disease every year, 3,500 die from plaque rupture. Most of them are not being treated. I don't know any other disease in the world where the first time you know you have the disease is you're dead. That's not the way you should be knowing about a disease. You can imagine if 5,000 people were being killed on the roads. Imagine if I said to you on the roads, 3,500 people were being killed on the roads, and we could identify those people whose car had a problem in it before they crashed and killed themselves. There would be uproar. And, it is a lot up to people to take responsibility. And I think Ross made the point. A lot of people don't want to change and don't want to take that. But give people the information and the option to do that. And I think with older people, where the framing becomes particularly muddy, 12 times more people in the top quartile have an event who have a calcification score in the top 25 percentile. So it's the focus, though, on cardiology is that they treat the event. They focus on arteries. They focus on blockages. That's what they've trained, that's what they do, that's what they get remunerated. And don't get me wrong, it's not that they are dealing with patients in front of them. They're not the people who should be dictating the agenda. The agenda should be taken upon people having the information for you to take control. We've had institutions before, whether it's the church, the bank, that tell you what to do. We set the rules, you do what we say. And this is about people having the information to make an individual choice. And the conspiracy of silence for 30 years is one of the most disgraceful things I can tell you. So we now have a system whereby, again, going back to breast cancer, and you see the force of all of the studies. The excuse factor as to why this hasn't been there, Ivor went through some of them. But the biggest one is that this is we don't have a randomized trial. So basically, with cancer, we're going to say to you, we're not going to do a mammogram for you women because we haven't done a randomized trial to see whether by doing that we get better outcomes than if we don't do that. And then when you need your breasts removed or mastectomy, we're then going to put you on a disease management program, which we know works. And that's what we do with cardiology. We basically say to people, well, we don't want to promote this test, even though we know plaque identifies disease, even though we know how to treat the disease when you have it, because putting on statins reduces inflammation, stabilizes plaque, and reduces thrombosis. So it is not the only thing. It is not clearly, but it is a very important, because 70% of heart attacks come from plaque rupture. It really manages the ability to rupture. So, the excuse factor, well, it's not 100%, well, it's 99%. Or the excuse factor, it doesn't tell me what artery to fix. No, 70% of heart attacks are plaque rupture. We need a randomized trial. That held that up for 20 years. 20 years, I want a randomized trial, which we've never looked for any other disease. And that guy, Neeson, how he can get up there. And nobody questions him. No one has ever said in the world, I don't think, Neeson, you are right. That is not the way you treat any other disease. Because he says it, and everybody has to accept what he says. And the other factor which I know is a point is that, well, we can't give it to everybody because it's €200 and those are medical cards, can't have it. And yet we don't give people a choice. If someone wants to spend €5 on a packet of cigarettes, it's €200 in a year. We're not giving people a choice. And of course it should be more available. And it's not just for a group of people. But at least give people the choice to have a test that can really have a huge impact on their lives. So, as I say, the whole message, we can't have the 60 cardiologists dealing with it on a world basis. It has to go back down to the doctors. It has to be a screen program. You get a score. He knows if you're over in the worst 25%, you need to go on treatment program. And if you're at a higher score, you may need to do a stress test. But 99% of doctors, even though it's in the guidelines, should be considered for asymptomatic middle risk patients. 99% of the patients don't know, and 99% of the doctors don't know. Because who's going to tell them? And cardiology is about treating the event. And they still give the same reasons as to why they don't like the test, even though it's in the guidelines today. So, it really is, it's about how does this battle go forward? How does social media be involved in it? How do we see the importance of giving people the information to manage their health? How do we move away from this blame game? If you have a heart attack, well, you did something wrong. You sinned and you're punished. It's not. This is a progressive disease. It is very clearly managed, and people have to take responsibility for their health in doing that. And it's about bringing that change and bringing that change forward. Now, what my problem was, which I found out after, it didn't all come together. Basically, I'm a diabetic. Your blood levels should be between 4 and 6, and if I take any bit of carb, I hit 30. So I never knew that because I didn't pass the test. So that was the cause of what it was. But there's so many different causes. So for me, my diet, as the low-carb diet, is unbelievably important. This has put a huge amount of my time and resources. But if I can save one life, if I can help many people have the same opportunity as I had, why should somebody like myself have this opportunity that's not given to others? And that's driven me every day. Every single day. I've spent a lot of time, my family have suffered because of that commitment to this, and I'm just very fortunate to have such a loving family, but it really has been. And I suppose I can't do it myself, but I'm going to ask Ivor. There's two people who are here who have been very brave to come here, and I'd just like Ivor to read out their letters, because this is what the force of why we've got to bring change. Change is not going to happen by itself. Change is only going to happen when people get onto the airwaves, when they demand the guidelines is put into place, and when we bring about a society that we can be proud of. Because in cardiology, we cannot be proud of. It is a really sad way. Even though the cardiologists do the very best they can with the people in front of them, it isn't they do what they can do. It's the powers above that keep control of this agenda, and that's got to change. So, Ivor, would you read out the couple of letters for me? Thanks. Thank you.
Okay, I'm going to go ahead and read a couple of the letters sent into radio shows, etc., from people who, either at David's request or by seeing the movie or the other documentaries, went ahead and got a calcification scan and found out they had very high risk indeed. So here's the first one. Hi Ray, I have never contacted a radio program before, but upon hearing of Ciara's email on Monday about her dad following his calcification test, I had to write to you. I am also lucky like her dad. I am a 53-year-old male, heard your segment on calcium scores a few months ago, went to my GP for a full checkup. Results revealed standard blood pressure, normal cholesterol, non-diabetic, bit overweight, advised more exercise. I also got a referral note for the calcification test from my GP after hearing the interview on your show. The results were so shockingly high I was rushed in front of a cardiologist the following day. That was months ago. I am now managing my heart disease successfully, so relieved that I was not found dead on a footpath, leaving my wife a widow and my rugrats fatherless.
To put it mildly, my GP later described my condition as a dead man walking, with a heart attack inevitable over the coming months, and as a GP he would never have guessed. My dad died of a massive coronary heart attack when he was 59 years old, with no warning or symptoms. I was 19 at the time, and have been extremely annoyed over the years that we did not have a chance to have a bit of crack together, perhaps the odd pint, the odd match, my wedding, the birth of my children, even the odd loan of 50 quid when the last week of the month appeared. If only he had heard of the calcification test prior to his coronary. Ray, please keep this message on your radio show, raising the awareness that cardiac disease can be detected before an attack or obvious pain in the chest for men and women. The doctors and cardiologists are very well qualified if they are presented with a patient who is still alive, but they are not really able to do anything with a heart from the morgue. Thank God for the man who set up the IHDA charity, Irish Heart Disease Awareness, David Bobbett. Take care. I'll just read the second sample letter now. For 2 years, David prodded, indeed insisted that I take the calcification test. I was in my early 60s, felt fit, did my executive health test yearly and always passed no problem. I coached rugby teams, played golf and felt great. David invited me to the premiere of The Widowmaker, and afterwards I told my wife I would look into it. I was later again talking about the test when a man who had recently suffered a bad stroke told me to just do it. So resulting from the request of David and his tenacious efforts, I finally got the test. My results showed a massive build-up of calcification around my heart, with a CAC score of well over 1,000. I was in the highest percentile category, in great danger of an imminent heart attack. I had no inkling or symptoms related to what was going on in my body whatsoever. My GP called to my house and whisked me off to a cardiologist who over the next days carried out further examinations. The angiogram showed 3 to 4 90% blockages in my left main artery, the artery which generally supplies 80% of the blood to the heart. I was not allowed to leave the hospital. In fact, I was booked for immediate bypass surgery the next day. I devoted the period afterwards to my recovery with diet, exercise and rest, and I feel really good now, even if a bit shell-shocked. It's been a journey, and I want to thank the nurses, doctors and surgeons who do such a fantastic job when the event occurs and someone gets to the hospital in time. But unfortunately 36% of the people never get there. They're dead. And who represents them?
And I suppose the fact that the movie has been there, we have had hundreds of people writing into the IHDA who have done what they've done. These two people have been very brave. A lot of people don't want to say it. It's on Netflix US. There's been huge upsurge in this test. So it's a mammogram. I don't go to a woman and say, I say to a woman, eat right, don't drink too much, don't smoke. What are your family history? But that doesn't. If you don't do those things, you're more likely to have breast cancer. You're more likely to have any form of disease. But there is a test that tells you if you have breast cancer, and there's a test to tell you if you got heart disease, because calcified plaque only arises in diseased vessels. So it's very clear, and it's going to get progressive unless you do something about it. So it's no matter what you look at. It's not. Of course, if you're going to do all the things wrong, you're more likely to have it. But this isn't a percentage game. Death is an individual game, and everyone has that right to that information. So I really hope tonight that people will drive change and write in, put it in. But I'm not looking for this for myself. I'm just looking for people to get the opportunity that I had. And please help drive that change, because this issue really deserves it. So thank you.